AyurVAID has laid down a clear protocol that incorporates the conventional understanding of management of type 2 diabetes, where patients come with the gold standards of HbA1c, fasting blood sugar, postprandial blood sugar, urine, presence of glucose in urine, and we also consider various other markers like urine microalbumin, kidney function, lipids and liver function. With all these biomarkers in hand and clinical presentation of a type 2 diabetes patient, at AyurVAID hospitals, we lay down a disease tree, a unique disease pathway that helps a physician to understand what are the causes of diabetes, how is it that it is progressing, and what are the emerging risk factors and complications. With this, a treatment plan comprises of giving a prescription of ahar, that is diet, lifestyle, Ayurveda medications and Panchakarma treatments. For diabetes, as we understand that in a typical conventional setup, there is a prescription that follows with the advice on diet, lifestyle and weight management from an endocrinologist with a follow-up every 3 months. We do see when we have patients who come already with this approach that patients are not able to completely adhere to diet and lifestyle. Diabetes is something where we have understood at AyurVAID that patient needs an active hand-holding. At journey of a patient of diabetes at AyurVAID, at the beginning of the treatment and consultation, we have a consensus and a memorandum of understanding with the patient to help him to go through this journey together. And we help the patient not only targeting the glycemic burden by looking at HbA1c, but overall components, the whole journey of transformation that begins for a patient of diabetes from being mindful about how he is eating, what he is eating, when he is eating. All of these important points are made aware to the patient. So, patient is extremely mindful in his day-to-day routine. He owns up his own health and owns up his own markers of diabetes. And with this kind of a framework that we have at AyurVAID and that we work actively with the patients, guiding them, we have seen some remarkable outcomes. And we have seen that we have some outcomes where patients come with very high glycemic burden of 11.7, 11.3, coming down to 5.7, 5.3 in a span of about 6 months. This happens very systematically that ensures that the patient are kept extremely safe by reviewing them at regular intervals, by guiding them to carry out the markers. Now, there a point arises that are they already on some allopathy medications like oral hypoglycemic agents and insulin? Do we withdraw them? No, we do not withdraw them. We guide the patient to follow with their primary endocrinologist and inform the endocrinologist about taking Ayurveda system of medicine. There is a seamless integration and we ensure that there is no overlap of mode of action to keep the patient safe. There are scenarios as the time is changing. We do see as physicians very young patients coming to us with first time diagnosis. Patient works in an IT company, goes for a routine checkup and suddenly finds out that he or she is diabetic. And not just pre-diabetic, very high diabetic, like something which is about 10 or 11. At this point of time, we first carry out a detailed consultation. We complement that with other markers where kidney, liver, cardiac functions, everything is noted and taken into account. Once we have a grip on the pathogenesis and pathway of diabetes that is leading to, we guide the patient as I spoke about diet, lifestyle, and advice to go for Panchakarma treatments. And as required, medications, Ayurveda plant-based, natural and safe medicines are prescribed. And we see that with this approach, young patients who are on otherwise not able to manage themselves are doing quite well. And since we operate in an integrative space in quaternary care hospitals with an active dialogue with endocrinologists, we get straight referrals from endocrinologists for guiding the patient for weight reduction, for correcting their diet, lifestyle, and taking them through proper Panchakarma treatments. Therefore, it is important that anybody who is either at risk of diabetes or is already diabetic, they should plan to have a conversation with the physicians at Ayurveda hospitals. Unique protocol that captures your risk screening, that assesses your latent diabetes and its severity, if you are already pre-diabetic or diabetic with suboptimal outcomes or suffering through any complications, you will get a good, reassured, systemic and a safe solution at Ayurveda hospitals.